Hi everyone, welcome back. So today I am going to be talking about how massage can help those of you that have scar tissue. And I want to do this video because I see, quite a few clients who either want to relax scar tissue because, it's tight and it's causing pain or some other kind of dysfunction, or they want to minimize, the appearance of it for cosmetic reasons. Now, any scarring, whether it's from maybe a childhood accident or a surgery, whatever the cause, it can have lifelong effects. But scar tissue release will aim to release and realign the body's connective tissue, which then means, that the scars become often less visible as a result, as well as, the tissue itself becoming more relaxed. Now, there's not one single method, that works for every type of scar tissue. There are methods that are usually more effective based on the extent of the scarring. And, specialist massage techniques can treat both pain and immobility, even from sort of scar tissue that's really, quite a few years old. So first off, I'm going to explain the difference between scar tissue and adhesions. Now, scar tissue is basically where collagen fibres that usually, they help protect and strengthen a wound, basically just as part of the body's natural healing process, whether it's in response to injury or illness, surgery, maybe other medical treatments, something like radiotherapy, for example. So a scar is basically a concentration of thick, pale fibres which form on the skin or sometimes on the internal organs that have limited flexibility, circulation and sensation. Sometimes too much tissue grows and interferes with the body's functioning. And certainly keloid scarring would be, an example of this. So I'm just going to explain how scar tissue will influence our bodies. So scar tissue can cause all sorts of issues. Obviously, we've mentioned pain, and this can, turn into chronic pain. Also structural changes which cause limited mobility, electrical disconnection, so maybe problems with, the nerves transmitting messages, energetic disconnection, and emotional imbalances. Now, if we then look at adhesions, so adhesions, again, are part of the body's healing process in response to injury, illness, surgery, and again, other medical treatments. These adhesions are fibrous bands or thin sheets of tissue that grow as a result of, this trauma to the body. They stick other tissues and or internal organs together, which restricts movement and causes pain. Now, they have different names according to the size and location. So they may be referred to as microadhesions or cross-links. And the problem is that, quite often, for example, in cases of endometriosis, people might have some surgery called adhesiolysis, which is basically division of these adhesions. But the problem is that this actually causes more adhesions, which pushes the patient into a sort of a cycle of adhesions and surgery. And now, as we can see here, these adhesions can cause organs and body parts to twist or pull together, pull out of position, which will cause immobility. And in some cases, it can cause joints to become displaced, which will further obviously cause pain and poor posture. Now, scar tissue will never function, like the original tissue. But, hopefully I will show you in this video that soft tissue treatment not only helps to reduce, the formation and the appearance of scars, especially when done from the early stages, but also can reduce any, obviously we said pain, but any resulting tightness and restriction of movement that comes about as a result of that scar tissue. So the question is, why does this scar tissue form in the first place? Okay, so how does scar tissue form in muscles? Well, three sort of main ways. So we can have a partial or complete muscle tear. Something like whiplash or a sports injury. And in these cases, the body, senses the tear and repairs the break with scar tissue. Likewise, in micro tears in muscles, we will see, repetitive use of a muscle that results in these small tears in the muscle fibres. Quite often, they remain unnoticed. They don't even produce many symptoms. And the body senses these micro tears and repairs them again with scar tissue. The third way is through sustained contraction. So if we have overuse, maybe through our lifestyle or our occupation, if we, have bad posture, or if we work at a computer all day, the muscles are constantly held, for long periods of time in a sort of a state of contraction and tension. So what happens then is that all of these, capillaries and blood vessels running through the muscle tissue, because the muscle is tight, the blood can't get to all the parts of the muscle because these blood vessels get constricted. And so the part of the muscle tissue that doesn't get enough oxygen through that blood dies, and then hence scar tissue forms. So we see three stages in scar tissue formation. Stage one is that inflammatory phase. So when we have a wound, the immune system kicks in, it clears all that bacteria and debris, ready for the body to heal itself. And this is what causes the heat, the redness and swelling that is associated with inflammation. And so this inflammatory phase usually lasts around sort of 3 to 6 days. Then we move on to stage 2, which is the regeneration stage. This usually lasts for approximately 4 weeks, dependent on the size of the wound. And this is where new collagen fibres and blood vessels are formed. The wound will slowly contract and new skin begins to form. Then we go on to stage 3, which is the maturation stage, where new collagen forms, which increases the strength of the tissue and changes the shape of the wound area. Now, this stage can last for up to 2 years. So it's quite a long, stage. And so this is why, quite often as medical professionals, we say that even though something is, appears healed on the outside, your body is still healing on the inside. And that's certainly, true with scar tissue. So I'm just going to sort of give you a diagram to show you sort of the difference in the muscle tissue, from before injury to after. So we can see here that, pre-injury, you've got healthy muscle tissue, and then when obviously we experience some sort of injury, the tissue becomes strained. And so the scar tissue then forms. You can see on this third picture here, all of these white sort of fibrous bands where the collagen is trying to reform. And the scar tissue forms, causing that tightness in the tissue because you've got all these extra collagen bands. And obviously then when it gets to that stage, the scar tissue is formed, you've got a higher risk of, injury again. And this also leads to reduced range of motion because of the tightness in that tissue. And so this leaves, although it leaves healed tissue, it also leaves the muscle weaker and less flexible. So if we look at the physiological things that happen, that can cause scar tissue, we've mentioned in terms of following on from a muscle strain, whether that be involving a partial or full tear of the muscle tissue, or these little micro tears that occur gradually over time. Scar tissue then happens because the muscle fibres can't cope with the amount of force that's being placed on them. We've then got the surgical issue, where surgery can cause scars, probably beyond obviously the typical type of scar tissue that we would see with something like a muscle tear. And obviously, that's external, and some people have additional issues with keloid scarring, which obviously cosmetically can bring further issues. Any kind of trauma, whether it be, fractures, sprains, cuts, burns, so it can be external, trauma, or it can be internal. Other medical issues or treatments that can bring about scar tissue. So anything where there's inflammation or infection, colitis, diverticulitis, pelvic inflammatory disease, endometriosis, which I've also done a video about. These sort of medical conditions that cause this sort of internal trauma. Hepatitis, radiotherapy, or, basically anything after surgery or injury where, the body doesn't know how to arrange those collagen cells, which are usually aligned in very specific ways in order to promote tissue strength. So because the body doesn't know automatically how to arrange these cells. They kind of clump together. They reform to heal the tissue, but they clump together in a sort of an abnormal way. And so this causes then that scar tissue. But it is possible to almost, I suppose, remodel this scar tissue so that it can resemble healthy tissue again. Now, again, it's probably never going to be the same as it was before the scar tissue occurred, but it can certainly, you know, become a lot more healthy, you know, with increased range of motion and less pain, etc. So firstly, we're going to look at why is scar tissue important. So treatments to promote healthy tissue as early as possible will help to prevent further problems and further injury, and allow the injured tissue to tolerate, you know, everyday stresses and forces. And in doing this, you know, you're going to reduce pain, you're going to improve range of motion in the surrounding joints and muscles, and restore normal mobility and function. You know, will help prevent build-up scar tissue around nerves, which can lead to pain and numbness. You know, scar tissue around, and adhesions as well, around, you know, internal organs, so the ovaries, the uterus, the testes, you know, which scar tissue here can, you know, really impact on fertility. And also, you know, it can affect functioning of the intestines, the liver, heart, the lungs, you know, sometimes affecting breathing. So, you know, it's really important to not only look at the outer appearance of scar tissue, but to look at how it's affecting someone on the inside, which often, you know, people don't think about when they think about scar tissue. And of course, there's always, you know, the cosmetic factor as well, you know, which again, you know, in some cases it can really change someone's, you know, build their confidence and therefore change their quality of life in terms of how they relate to people socially and how they view themselves. And, you know, this can have a knock-on effect on all sorts of areas of their life. Now, as always, I'm going to say the thing I always say, which is, you know, it is really important to find a therapist who is experienced in scar tissue, because treatment done where scars are not fully healed could actually delay healing or even expose the scar tissue to infection, which obviously is then going to worsen the problem. So in terms of treatment, with regards to massage, you know, massage can benefit scar tissue involving, you know, the muscles, tendons, ligaments, joints, by relaxing the muscles that are involved and helping to also restore nerve function. Changes to the scar tissue itself may take time, but in the meantime, you know, improved mobility in the area of the scarring will certainly be apparent. And obviously, again, you've got the circulatory factor where, you know, by sort of bringing, you know, improved blood flow and oxygen to those tissues to again help healing. Stretching and, you know, flexibility exercises alongside massage in particular can really help to lengthen, you know, and improve the mobility of those injured tissues. So, you know, certainly it's best to use the two treatment methods together. Treatment on new scars and adhesions, you want to really wait I'd say around 12 weeks. But if we're talking abdominal or sort of scarring to the internal organs, then you want to wait longer, because scars around the abdominal area and internal scars do take longer to heal. At least 6 treatments are recommended for scarring, unless it is a really superficial scarring. And, on scars less than 2 years old, it's possible that scar tissue may pretty much completely go with the right treatment. But, that's not guaranteed. And it's going to vary, on each individual. Adhesions, we're looking at treating twice a week over the course of several months, again, depending on the size of the adhesions and how long they've been there. And between treatments, there are things that you can do at home, just to kind of increase the effects. So warming the area with a hot water bottle, because the heat will help again to loosen those fibres and to prolong the effects of the massage. Or you can place a compress soaked in castor oil on the affected area for an hour to an hour and a half, which will help to break up that scar tissue and any adhesions. Now, there are other treatments. Oils can be used, particularly oils with vitamin E, lavender oil, or even aloe vera. And this will moisturise minor scars, maybe something due to cuts or burns, small burns at home. And this will help to soften the dead tissue and slowly reduce the size, of the scar. It may also help to fade the scar as well. Certainly, from my experience as a nurse in cosmetic surgery, there was, I can't remember exactly what it was called, but it was a silicone-based gel. And that can be sometimes used after surgeries, again, to just reduce the appearance of the scar, take any redness out. And that's actually really quite good, but obviously that is a prescription only. Obviously we mentioned vitamin E, as an oil, but certainly taking supplements such as vitamin E and also vitamin C, which can help facilitate healing, can boost the immune system, and just help with the granulation of healthy tissue around that scar site. Also, beta carotene and zinc may be beneficial. Treatments such as dermabrasion, but this will be for heavier scarring. This will help to reduce the dead tissue and restore, a more even texture and hue to the skin. This may be the best way to deal with any scar tissue that can't be minimised through other methods. So this is more sort of towards the last resort kind of stage. Now, obviously, there is a surgical option, particularly with adhesions, which, again, this is really a last resort to remove the accumulation of the tissue if no other treatment has reduced the scarring. Now, surgery, as we've said, is more likely with soft tissue injuries, where the scar tissue develops around a tendon or a ligament. you know, or maybe something, as we've mentioned, like with endometriosis, where you get those internal adhesions. But, you know, I emphasize again the fact that the surgery itself will form scar tissue. So, you know, it's, while in the short term it can, you know, resolve the situation, there's a high incidence of reoccurrence in the long term, because once again, although you're getting rid of some adhesions and scar tissue, actually just by the means by which you're doing that, you know, you're also introducing more scar tissue. So okay, so in terms of scar tissue massage techniques, this kind of goes in stages. So stage 1, we're looking at soft tissue treatment. So this will focus on, you know, assisting the body to reduce swelling, just using gentle strokes away from the wound site while avoiding direct pressure or any kind of manipulation directly over that, you know, that scar. Then stage 2, if the pain level allows, we can start on mobilization of the injured site, which can encourage blood flow. Obviously brings oxygen and nutrients into the, you know, that tissue, and reduce the formation of adhesions. Then stage 3, we're looking at a more direct and intense treatment on the scar itself. Once the wound has closed, to restore restricted movement due to those fibrous adhesions, scar tissue, and shortened structures. Now, again, we've talked about oil lubrication of that tissue. Oil containing vitamin E is ideal, and will keep the scar and the surrounding tissue pliable during treatment. Again, you know, in between treatments, warming the tissues to lengthen and realign them. So you can do that at home using a hot water bottle, but also just the warmth that you get from a massage itself will assist with that. Now, some people may use kinesiology tape, which can be used to provide a low intensity stretch to help align collagen, you know, the collagen cells. But, you know, I would only recommend, you know, some people, they go off, they look at things on the internet, and then they, you know, they think, oh yeah, I know how to do that. And the likelihood is they're probably applying it wrong, or, you know, potentially doing more damage. So if you're looking into that as an option, do see a registered and qualified kinesiologist. Cross fiber friction. This is really useful with scar tissue. You know, it can be used to massage the tissue perpendicular to the scar for usually around 5 to 10 minutes. And what this does is it helps to align those collagen fibers, you know, by breaking up the hardened tissue. And of course, we mentioned, you know, the reason that scar tissue forms is because the body doesn't automatically know how to correctly, you know, align those collagen fibers, which is why you get that, all that built up sort of hardened scar tissue. Also, myofascial release, where the hands will slowly massage the skin and the underlying tissues around the scar, feeling for any restrictions in the fascia and working to just improve the movement. And then, you know, we can also look at things like instrument assisted massage. So where instruments of various sizes may be used to mobilize the tissues, helping to break up those built up collagen cells. And of course, we've got the stretching exercises, you know, to maintain flexibility and muscle length, which, as I've said, will work really well alongside any massage therapy. So it's really a combination of massage, stretching, and then those things that I've mentioned about doing at home that will probably give you the best results. And, you know, again, this is something where it's not going to be a case of, oh yeah, I've got some scar tissue, I'll go along for a massage, that'll sort it out. You know, this is something that will involve a course of treatment. You know, I would say over, you know, certainly a few months. So yeah, that is really how massage can help with scar tissue and adhesions. You know, any questions, feel free to comment down below, or you can contact me through my Facebook or Instagram, and I will do my best to answer you. Feel free to subscribe to my channel, and you will see, you know, those other videos on things like endometriosis, and also be notified of any other videos that I will have coming up. But for now, that is really all from me. So yeah, take care, and I'll see you next time.